My name's Mark Davies. I'm a General and Colorectal Surgeon based in Swansea. I offer a number of general surgical procedures, including hernia repairs, and that will include inguinal hernias, umbilical hernias, incisional hernias. I also offer colorectal expertise, and that will be diagnostics in terms of colonoscopy, for rectal bleeding, changing bowel habit, and also a number of commonly performed proctological operations such as hemorrhoidectomy, surgery for fissures and fistulas. And then we offer also major resections for conditions such as colorectal cancer, diverticular disease, and inflammatory bowel disease. I think embarrassment is often a key factor in delay in presenting. Also, the symptoms can be quite easily ignored. People sometimes just put down bleeding to piles. Also, change in bowel habit is sometimes attributed to other issues. And for that reason, I think there is a delay in people presenting. So I think it is really important that patients see their general practitioner if they have any change in bowel habit at all. Again, with hemorrhoids, it's an embarrassment factor, and patients often have had them for many years before presenting, and they finally pluck up courage to do something about sometimes awful symptoms that they have, and they're life-changing symptoms in terms of bleeding or pain and discomfort. So often they're too embarrassed to come, but often the treatments can be very simple, and in some cases not as painful as perhaps thought. But it would be sensible, I think, to get them checked out, and also usually get a number of treatment options which would be tailored to the patient's wishes. Hemorrhoids are dilated blood vessels around the anus. We have anal cushions, and they are there as part of normal anatomy, and they serve as a function to keep us continent. But over time and perhaps straining, they become dilated, start prolapsing down, and then become larger and then bleed. Symptoms of hemorrhoids will include bleeding, the formation of lumps, but also discomfort, itching, and a very unpleasant feeling of a fullness in the bottom. I think rectal bleeding would be a concern, and they shouldn't ignore that. It should be checked out. It doesn't mean that they have cancer or anything serious, but I think just ignoring it is, too many times I've heard stories that, I just thought they were hemorrhoids. So I would check out rectal bleeding. I'd look at reputable sites, and the NHS provides a very good overview of what hemorrhoids are and the potential treatments. If you look at the treatments, there are many different treatments, but I would urge patients to look at nice approved treatments and also talk to a doctor about the options that best suit them. A colonoscopy, well, it's an invasive procedure, but it's an invasive procedure that's usually finished very quickly. It takes about 20 minutes to half an hour. Patients do need to take bowel prep, which would usually take the day before the procedure, and then they would come up and have the camera test. The camera is a fiber optic camera. It's very thin, but it can be an uncomfortable procedure at times. We give sedation, and we can give strong pain relief, and we can give gas and air. Some patients find they don't need anything to have it done. So it's a camera test of the bowel, and it's usually 20 minutes, half an hour. And in most cases, it will reassure the patients regarding their symptoms. So diverticular disease is a condition that we see commonly with Western diets, and it affects the large bowel. The bowel should be like a cylinder, but as we get older, you get these little saccules that form. They're very common, and having the presence of diverticuli does not mean diverticulitis. Diverticulitis refers to inflammation of these little saccules, and that can cause problems such as pain, bleeding, change in bowel habit. It's a condition, once diagnosed, it can't really be prevented. It's about then mitigating the symptoms. So we would recommend a high fiber diet and perhaps plenty of oral hydration. Most of the conditions that we will see are not cancer. But that doesn't mean they're not important, and they do have a profound effect on people's quality of life: bleeding, pain, discomfort, embarrassment. So I would urge patients to go and see their doctor, because consultation is usually very straightforward, and we would discuss the symptoms, we would examine and then provide an explanation of what we've found or what my thoughts are, and then we would come up with a treatment or investigative plan based on the patient's wishes. I think, as I've said, listening to the patient, listening to their concerns, and trying to work out a plan that works for the patient and works in their sort of beliefs and understanding. But also, I think that we operate on patients regularly, but in terms of follow-up, I think it's really important that patients are followed up. One of the great things about here is that they can be followed up easily. They're not lost for follow-up, and they're not ringing to chase follow-up appointments. And I think that's really important in the immediate post-operative period where patients will be outside their comfort zone having surgery. There's always someone here to look at a wound or to give them reassurance, but also surgical outpatients. We can see the patients at short notice. So it's not like the National Health Service where patients often have to wait for an appointment. And I would make sure that the patients are happy before discharging them back to their general practitioner. So Crohn's disease is a variable condition, and it can be a very cruel condition. Most patients will be reasonably well and well controlled with their medications, but it does have a significant impact on patients' life. They can experience a number of awful symptoms, including abdominal pain and frequency of bowel action. Surgery is reserved for patients with Crohn's disease for the complications of the disease. Whereas ulcerative colitis, we sometimes use operative strategies to get rid of the disease. With Crohn's, it's reserved for the complications of the disease. Very few patients with Crohn's will actually come to surgery. And I think it's a real hope that we should reduce the number of patients who need emergency surgery for Crohn's disease. That will be better medical management, but also an earlier interface with surgical colleagues to allow a more planned transition to surgery. Medicine's a great career, and surgery is brilliant. Every day is different. It's a wide repertoire of different things. We see patients in clinic, we're doing endoscopy, we're doing operations, we're doing major operations, doing smaller operations. It's great, it's varied, and every day is different, and that it keeps one's brain ticking over. Theatre is it can be a very challenging environment, but it's a friendly environment, and I think teamwork is absolutely fundamental to safe and efficient surgery. So every patient will be seen on the ward in the morning, and then will come through to theatre and will be welcomed by the team. The theatre team will go and collect the patient, bring them to the theatre, and then take them back to the ward after the operation. It's a very comfortable environment. Although it's clinical and patients will be outside their comfort zone, it's a very, I think it puts patients at ease, and it's a very friendly, professional environment. My name's Mark Davies. I'm a General and Colorectal Surgeon at Sancta Maria Hospital in Swansea. Please get in touch if you need more information. Thank you.